I hear people talking about their low back pain. Sometimes they use the word sciatica. Is there sciatica and low back pain? What's the difference between the two?
Well, that's a good question. It's an important one that I want your viewers to understand, is that there is a difference between low back pain and radicular pain, and that means sciatica, where pain's running down your leg. We treat them differently.
So if somebody has sciatica, where does the pain radiate in the leg? The front part, side, back?
Classic sciatica is going down the back of the thigh and even into the calf, and that's the classic version of it.
People get buttock pain?
Absolutely, and most of the time buttock pain represents a variant of low back pain. It's referred pain, meaning your body is not sure where to map that pain, and so you're feeling it in your buttock, but the injured portion's actually in your low back.
Why is it important to differentiate low back pain and sciatica? If you've got pain shooting down the leg, what does that make you think of?
We treat them differently, so it's very important for the healthcare provider to differentiate, as well as the patient, the pain in the low back from the pain from, say, a pinched nerve like sciatica, because we treat a pinched nerve differently than we just treat back pain.
How do you treat them different? Teach me how you treat one and treat the other.
Well, physical therapy is a crucial element of the treatment of low back disorders, both back pain and the sciatic pain going down your leg. Physical therapy is the first line of treatment, because when we have back pain, we start to move differently, and when we move differently, we get out of kilter, and our muscle groups are not working together.
One problem causes another later on.
Absolutely. So getting together with a physical therapist is always the first step in getting better back health.
If somebody has big time bad sciatica and it starts causing weakness in some muscles, what muscles does it cause weakness in?
The most common muscles that we have weakness in are the toes or the feet. And if it's higher up, occasionally you can have weakness around the knee or even the hip.
Is that a dangerous sign?
It can be a dangerous sign. We pay a lot of attention to weakness and numbness, because that suggests that the nerves are being injured. The most dangerous signs that we look for as surgeons are people who have progressive weakness, meaning that continually gets worse as time goes by, or people who start having problems using the bathroom, like bowel or bladder symptoms. That can be very concerning and is really an emergency.
So yeah, then it's time to get the action plan.
It's time to get on the phone or get to the hospital.